I was born in Washington, D.C. I'm one of those very few people who were born and lived in Washington, D.C.
And what did your father do?
My father worked for the Internal Revenue Service. He was in the office of the Chief Counsel, and when he retired, he was chief of the office of the Chief Counsel of the Internal Revenue Service of the United States of America. Well, I went to college at Trinity College of Duke University, and I went to Duke University School of Medicine. And that's where I met my wife. She was a graduate of Duke School of Nursing, and she was on the floor and helped me in doing everything, trying to get me out of the medical school. She didn't know that she was going to be my wife at that time. I didn't know it either. As far as I know, I've always wanted to be a doctor. I never wanted to be a fireman or a lawyer or a garbage man or anything of that sort. I wanted to be a doctor, I'm told.
When you were a child?
Yep, when I was a child.
What do you think, what do you attribute that to?
I've often thought about that, Kirk, to be very honest. I don't know what it was due to. It could have been several things. I'm told that my dad had wanted to be a doctor and could not because his family couldn't afford it. He became a lawyer instead. And lots of people who want to be doctors become lawyers instead. And, but my brother was ill. He was my younger brother. He was ill for the first 6, 7 years of his life. And he and my mother and dad were away from our home most of the time because he was a patient in Hopkins for a long, long time, trying to find out what was wrong with him. And it could have been that that gave me some interest in medicine. I don't know. I don't know what it was.
What was his problem?
He had a congenital anomaly of his right ureter, which is the tube that connects the kidney and the bladder. And so he was having episodes of kidney colic all the time, and they couldn't figure out why, couldn't figure out what he had. Finally they did, and they did some, quote, experimental surgery, put a glass tube in him so he had to be in the bed all the time, because if he got hit or anything, the glass tube would break. And so that was kind of a catastrophe for him, but great for me because I had the run of the house.
Was he older than you?
No, he was younger than I was.
How many other brothers and sisters?
I had an older sister.
What was her name?
Betty Jean.
And what was your brother's?
Ralph.
Ralph. Mm-hmm. Is he still alive?
Yep.
Really? So
mm-hmm. He's 82.
Mm-hmm. You guys keep in touch?
Yep.
So he was young, he was ill when he was young.
Yep. But he's healthy now. He wasn't supposed to live till to his 40s. They didn't give him a chance at all. They even lived back then without surgery. He wasn't given any chance to live at all. But he's doing great. When we were kids, my mother had one of my mother's cousins was married to Ross McIntyre, who was the physician to President Roosevelt. And Admiral McIntyre at that time, actually was a captain at that time, not an admiral, but he arranged for us to have a personal tour of the White House. So my mother, my sister, my brother, and myself had a personal tour of the White House, and we got to meet President Roosevelt. And my brother and I guess we were 6 and 4, or maybe 7 and 5, or something like that. Weren't very big, but we're small enough that we could sit on President Roosevelt's knee. And my sister didn't get that privilege because she was 6 years old.
Do you remember it?
I do remember it, yeah. I remember seeing his private swimming pool, and I remember the fact that he was in a wheelchair, which was very well hidden to the public otherwise. But you know, the rest of it was really didn't really make much to me when we were growing up for that. But it was something. Now, you know, when you think back, you had a major privilege in doing that.
What was his condition? He
had polio and was paralyzed because of that. And one other thing about Mr. Roosevelt, during his 3rd inauguration, the ABC, which was the American Broadcasting System, or the Blue Network, not the Red Network, of NBC, decided that they'd have a couple of kids give the child or the young person's viewpoint of the inauguration. And so a gal by the name of Patty Lou Head and I were picked to do this. And our station was at the foot of the Treasury building on Pennsylvania Avenue, Constitution Avenue, Pennsylvania Avenue and 15th Street. And I got to broadcast over ABC all over the nation, and I had telegrams from my family in the West Coast and my family other places saying that they'd heard me and so forth and so on. And of course I said something very astute. I said, the Philadelphia Inquirer paper boys make a very picturesque picture as they march up Pennsylvania Avenue. Picturesque picture wasn't a really great thing to say, but I said it anyway. Mr. Kennedy, I knew before he was president. I had some friends who had access to his N Street house for some of his Georgetown parties that was before president then. But I did, while I was in the Navy in Washington, I was stationed at Maine Navy Dispensary before it was torn down. And my commanding officer was nominated to be Mr. Kennedy's personal physician with Janet Travell, who was a physiatrist. And Captain Berkeley was a very fine gentleman, but he did not know very much about Addison's disease. And Addison's disease is adrenal insufficiency, which Mr. Kennedy had. And since I had had specific training in endocrinology when I was in my residency, he'd call on me from the White House and he'd say, what do I do about Mr. Kennedy's cortisone level today? This is the situation. And I'd tell him. And that went on for the few months that I was, from January to July when I got out, 6 months, I guess. And I have to be honest, when I heard that he had been assassinated, the first thing I said, I hope they've given him some steroids. But I don't think he needed them at that time.
He was not a very healthy person, was he?
Apparently not. He had major back pain, which limited his activities, which he never told anybody about. But the major thing was that he had adrenal insufficiency, which is insufficient production of cortisone, which is a life-needed hormone, by your adrenal glands. And exactly why he had that, I don't know anybody knew. At least I didn't know why. At that time, back in the 50s, the most common cause was tuberculosis, but we didn't have any evidence that Mr. Kennedy had had tuberculosis.
My name's Robin, and I've worked for Dr. Pagter for about 18.5 years. And Ray's worked, how long have you worked?
I've worked 40 years. 40 years.
Wait, what?
Can you believe it?
Wait.
I've been with him for 40 years.
You can't believe it. She doesn't look old enough.
I'm not even 40. How long have you been in practice?
Been in practice in Tryon since 1961, which is 52, we've been here 52 years, almost 53.
Were there many other doctors in the area?
When I came, there were probably 6 practicing general practitioners. This was before the days of family physicians. They were known as general practitioners back then. We had an ophthalmologist. We had 2 surgeons when I came. Then I went into practice with the 2 surgeons and an anesthesiologist, and that was about it.
I have worked for Dr. Pagter for 40 years, and it's been the biggest blessing of my life.
My internship was at Strong Memorial Hospital, which was the teaching hospital of the University of Rochester Medical School, and my residency was at a university-affiliated hospital, Highland Hospital of Rochester.
Did you ever consider another type of practice rather than family practice?
No, as I was growing up, my ambition was to be a general practitioner on the eastern shore of Maryland, but when I finally got to looking for a place to practice, they didn't want an internist, and they didn't want anybody who hadn't been born there and inbred there, and so we looked other places. So I really didn't toy with anything other than being in the general practice of medicine. I thought I'd like being involved in pediatrics, but when I was on pediatrics was my first rotation in my internship, and the first month I was there, we lost several kids, and I just thought that was not right, that children shouldn't die. They should be able to live. I can understand old people dying, but I couldn't understand children dying back then. So I'd sort of limited myself to not, after having a residency in internal medicine, I'd limited myself to not doing any pediatrics and not doing any OBGYN and not doing any surgery of any sort. All I do right now is see my patients and think and try to get them well.
What was it like when you first started working with him?
I was scared to death of him at the very first, and then as time went on, it was just amazing, and he just kind of took me under his wing, and he trained me to do. I don't have a nursing degree, so he just trained me what he wanted me to do in the office, and it's all worked out great.
What's your definition of an internist, internal medicine? What does that mean?
That's somebody who takes care of the diseases or the organs that govern our body, regulate our body, like our heart, our lungs, our brain, our locomotion, backs, but it excludes the surgical treatment of a disease. It's more of a treatment with medicines and with health standards, I guess is the way to say it.
My name's Kathy, and I've been here about 12 years.
And you've been
18 and a half years,
this
and I'm
is my old
Robin.
thing, yeah. So you guys are not new hires.
No, sir.
We liked it and we stayed.
We love it.
We love it
We
here.
love
We don't
it.
know what we're going to do when you retire.
How long do you think that's going to be?
I don't know. It's
Really?
looking sooner.
You don't really want to think about it, do you?
No,
We
it's
don't.
bittersweet.
We don't.
Is it?
Yeah, yes. I mean, this is my home away from home. I mean, this
Yeah.
is my
Yes.
family away from my extended family.
Yeah, it
And,
really is.
You know, it's
You really wanted to be a doctor when you were a child. You became one. 50 some odd years later, do you feel like you made the right decision?
Yeah, I'm sure I did. I'm a minister of God that was called to practice medicine. I'm sure that God directed me to where I am today, and I'm sure I made the right decision. Now, if I were coming out today the way medicine is today, I'm not sure that I'd make the same decision. But I know that I made the right decision when I decided to go to medical school back in the 50s.
So with all of the things that you've seen in medicine, all the tragedies that we've seen around, being in medicine, seeing all that still reinforces your faith in God.
Yes, sir.
Can you tell me a little bit about that?
I am very serious about my relationship with God. I try to have God involved in every decision I make in reference to every patient I see. I'm continuing asking Him for help so that I can help my patients. It wasn't that way always, because there was a time that I didn't know Jesus as my Lord and Savior. And I got frustrated because I wasn't able to help people. They'd come in the same problem over and over and over and over again. And I just had no help for him in what medicine allowed.
We're with him every day, and I see him pray. I mean, if he's not sure what's going on in someone's life, he always prays and asks Jesus, God, show me how to help this person. And he's so humble, that if he may not know, he tries his best, inquire of God what is going on in someone's life. And
that was when our whole life changed for us. When we were born again, and he could get the help. I mean, he could pray and get answers to know how to help his patients. And that was a changing experience. It changed our whole lives.
What do you think about medicine now?
Right now, well, there's just too many regulations. Medicine, we're getting ready to transition from what's called ICD-9 to ICD-10, which is International Classification of Diseases, 9th edition versus 10th. And they're going from some 33,000 definitions to some over 1 million definitions, which is a coding system which is for the computers so that people 25,000 miles away from here can know exactly what the doctor thought of when they saw that person with right-sided abdominal pain. To me, that's getting too intrusive, I think.
And what do I like about him? Well, he's a professional doctor. We have a lot of doctors that are good golfers. And we got doctors that are good at tennis and so forth. But Pagter impressed me as a doctor, and also because of his thoroughness.
George Engel, and John Romana, who were the gurus of the psychiatric department at University of Rochester at that time, were working on what was now getting to be known as psychosomatic medicine, that the mind had a lot to do with how the body reacted. And they taught us, meaning the house staff that they had, that it was important to get to know your patient, to know about them, to know how they thought as well as how they felt. Now, they never said to us that a man is a spirit that lives in a body and has a soul. They taught us a man is a body that has a soul, and they didn't say anything about a spirit back then. So for a number of years, it was lacking but Jesus came into my life, and I found out we're a spirit. We have a body, and we live in a body, and we have a soul. Our body is just our suit of clothes that we wear while we're here on the earth. That's all it is. It's not worth anything. What is it, valued at 27 cents? But at any rate, the most important part of the man is the spirit.
And really, that's one of the reasons that he has patients that live as long as they do. Because there have been other patients that have switched physicians and have gone very rapidly downhill. Because their physician doesn't inquire of God, and he does.
And so I found that out in the 70s when I got interested in medicine of the whole person. We went to Sorrento, Italy, to a meeting with Dr. Paul Tournier, and the one thing I can remember that he talked about was, he said, if you fall out of God's right hand, he's going to catch you in his left. He's always going to be there to help you no matter what you do or where you go. Mm-hmm. And that stuck on me until this time. That was back in the early 70s that we went. I thought I had really thought about getting out of medicine about that time because I thought I'd burned out. I mean, I wasn't helping anybody.
How old were you at that point?
Well, I was in my 40s, early 40s.
You just felt like you were not helping.
That's right. At that time, anyway.
What was the event that caused that to make you feel that way?
Just people coming back with the same complaints all the time. The medicines didn't help. Medicines only blunted it. It didn't help. But I just didn't know. I didn't know how to help them. I hadn't been trained how to help them, even with what Dr. Engel and Dr. Romana had told me about. That was purely, I mean, we were beginning to get psychotherapeutic medicines at that time, but they weren't helping people. They made people worse, it seemed to me. We gave shock treatment and for depression, and people lost their memory, had changes in personality. We were exchanging one thing for another. We weren't doing anything. It was frustrating. And I didn't know Jesus, and so I got frustrated. That's all there was to it. I don't think I would have if I had known Jesus as my Lord and Savior, to be honest.
Mm-hmm.
Now, have I answered your question?
Are you talking to me? Or her?
I'm talking to you. I'm talking to myself.
When I have a physical with him, I get a report. Very detailed report on everything, and also the parameters of where it should be on the readings.
I know he spends at least an hour, Ray can tell you, with each patient, and he's concerned about him when he goes home. He's concerned about him when he wakes up, when he goes to bed. I mean, when he leaves this office, the phones are forwarded to his telephone, and so he gets calls during the night, in the morning, and he's never minded it one bit.
And I like Pagter because of his thoroughness, and because he reports, and he writes me a letter and puts it in writing. And there's no suppositions or wonderments, or he doesn't think it's his information. He thinks I have a right to know. And he's right, and he does it. That's what I like about him.
Can you tell me one of your most profound, just pick one out, memories of a patient that you had where you felt like it was a unique situation and you made an impact on both you and the patient?
Well, this week we got a letter from a gentleman who worked for Kemet. Okay, that's the successor to Union Carbide, for which your dad worked. And I've been seeing this guy maybe for 20 years, and sometime along the way I picked up that he had a diastolic heart murmur. Diastolic heart murmurs, at least when I was in medical school, meant there was something serious wrong with the heart. So we referred this gentleman to a cardiologist who did an echocardiogram for us, and we found out he had early aortic insufficiency, which is a leaking of the valve between the pumping chamber and the rest of the body, which puts an extra load on the heart. And if it persists and could get greater and greater and greater, it can lead to sudden death or complete disability. Well, we got a letter from this gentleman thanking me for having found it, because he had had his aortic valve replaced and was doing very well now, where he had not gone into heart failure and not gone into not able to take care of himself. So that to me is rewarding.
Where do you put him as far as other doctors are concerned? I mean, not on a scale of 1 to 10, but I mean, do you consider him to be almost in the great category?
Yes.
Oh yeah,
Yeah.
He's definitely a 10.
definitely.
I remember years and years and years ago when an older lady came in and looked very ashen and pale, and I talked with her, and we got her blood studies and found out she had pernicious anemia, and this was after she'd been seen by several doctors for a period of years. And the first time I saw her, we found out she had pernicious anemia, started her on B12, and the next week she was jumping up and dancing, where she could hardly walk in that time. That's a long, long time ago, but that was a very enthusiastically received response to therapy.
One of the stories that I was telling Robin, when he, stories of things that he's done for patients is, a young man that had a hole in the back of his heart, and he knew something was wrong, and it wasn't until the third cardiologist he sent him to found it. But he knew something was wrong, And the first cardiologist didn't find it, so he sent him to another cardiologist. Finally, the third one looked behind the heart and found the hole.
Oh, let's see. I started in 1970, so that's 30, 40. What is this? 14. This will be the 44th year.
He spends at least 2.5 hours with the individual. He interviews them first about their life, and I mean, from what they eat to whether they have pets, where they travel. He goes from all of that, and then how they're, what's going on with them physically.
What would be your advice to the younger crew coming on board medicine?
Well, I'd say listen to the patient, number one. Unfortunately, the new doctors who are graduating from medical school right now, I'm not sure that many of them could pick up a very soft diastolic murmur such as I heard in this man, because they're not taught to do that. They're relying on echocardiograms or other things rather than their stethoscope. I still think the personal history, which is listening to the patient, and the physical examination, which is you doing the things, not the machines doing the thing, are very important to the care of patients.
There have been several instances where Dr. Pagter has diagnosed things that the other doctors, I don't know if other doctors had seen them or not, but where he helped the patient because everybody else had either missed it or they didn't see somebody.
That's right.
But life-changing,
especially with the area of the heart.
Yes.
And even breast cancer in ladies, he's detected that many times.
I have a little bit of problem with doctors. At one time, when I was very young, I thought I might want to be a doctor. So I took all the pre-med courses, and I got to know all the guys who were in pre-med, and some of them were my best friends. But I also got to know a lot of other doctors, and for the most part, I'm unimpressed by these guys.
How do you deal with some of the patients' personalities and, reading, you could kind of tell what's going on with them, but...
You just have to be patient and talk with them. That's all I know to do. True, there was an old adage in medical school, if the lady said she'd had 2 glasses of wine at night, it usually was 4 to 6. If a man said he had 2 glasses of drinks, it was usually 8 to 10.
But Pagter, I find, knows what's going on, and he has some opinions and keeps them to himself. So I just think he's a refreshing guy to see every 6 months or so, and know that I'm going to make it for another monthly visit someday.
I think that most people, when they first enter the medical system, are honest, but they learn how to play the medical game, and they will say the things that they think will get what they want from the doctor after they've been in it for a while.
We were talking this morning, I don't know what we're going to do without him, because I don't know who takes the time to do that, this day and hour.
If you were to tell someone how they can best take care of themselves.
Well, basically, Kirk, it gets down to knowing Jesus as your Lord and Savior. If everybody knew Jesus as their Lord and Savior and had a personal relationship with Him, I believe God talks to me. I have lots of patients who don't believe that God talks to me, but I believe He does. I think my wife believes God talks to her. Robin believes God talks to her. Kathy believes that God talks to her. Ray believes that God talks to her. I think we serve the people better because of this, and I think that's the basic thing. Meet Jesus as your Lord and Savior. His arms are open wide. He's waiting for you to come in. And He's just there for you to say, help me. That's all He wants. I don't think there's any better advice than that.